My name is Chelsea Kern, and I am 23 years old, and I am currently suffering endometriosis.
Hi, my name is April. I have stage 4 endometriosis, and I'm also an advocate for it.
Yeah, hi, my name's Joe, and my wife has endometriosis.
I am Amanda Luria. I'm 32 years old, and I am an endo patient.
Hi, I'm Jennifer Rutner. I'm an infertility advocate and mother to Hannah, a 2-year-old that my husband and I adopted. I am 34 years old. I've been struggling with infertility and endometriosis. Well, endometriosis for my life and infertility for the past 6 years. Hi, my name is Lauren. I am a part of the infertility community. I've been diagnosed with PCOS, hypothyroidism, and a possible endometriosis diagnosis.
My name is Lauren Tate. I am an endometriosis patient, and in addition to that, I am also the New Jersey leader of the Endo Warriors Support Group for Women, and I also attend local medical events such as the EFA events that are occurring in April and throughout the year.
I am Marin Moore, and I am an endometriosis patient.
Hi, my name is Sally Sorrell. I'm a pelvic pain physical therapist and a woman with endometriosis.
I'm Colleen King. I'm an endometriosis patient, currently 40 years old, diagnosed at 22 years of age.
My first symptoms of endometriosis actually came with my first period when I was 11. My periods were so heavy and so painful. They would last for more than 2 weeks, and then I would have 1 week without my period, and then I would have my period for 2 weeks again.
I had my menstrual cycle when I was 9 years old. I've had cramps ever since I was 9 years old. Did not even know what that even meant. I just thought that cramps were normal.
When I would get my period, I would not only have heavy bleeding. In fact, I remember being a little girl and going to sleepaway camp, and my bag spilled, and all the other girls in the bunk made fun of me because I needed the supersized tampons, and yet they only needed the small little regular size because we were just 13-year-olds.
I first started noticing symptoms of what I now know are endometriosis when I was very small, even as early as I can remember when I was in Catholic school, like 8 or 9. I would have these terrible pains in my leg, and I was a very active child, so, I didn't think it was like muscular strain or something like that. My mom never really understood what it was, but it was very, very painful, and I would cry.
My periods came on very early. I believe I was 10 when they started. They were very long, heavy, painful. I used to be the kid who wore the overnight pad in 5th grade to school and had to change it multiple times because my periods were that heavy.
But I was told that cramps were rather normal and that clotting was normal also because my mother, who never mentioned endometriosis to me, had endometriosis, so she thought everything was just normal.
The women that came before me, my mother and my aunts and my grandmother, they all talked about how terrible periods were and how much they bled and how much pain they were in, but it was pretty much a routine thing, nothing really to be concerned about.
My mom and I were just completely freaked out. We went to a gynecologist when I was 11 years old, which was a little more completely terrifying. It was completely terrifying. At the time, no one mentioned endometriosis, which would become a trend throughout my life. They offered to put me on the birth control pill. I was 11, so I said, no thank you. That's a little too much for me. And I was given iron pills for anemia. I was anemic for most of my life. And that was that.
When you're that young and you're getting your period for the first time, or you know what, let me rephrase that. When you're getting your period at any time, who the hell knows how bad cramps are supposed to hurt?
Throughout my adult life, I had brought different symptoms to different gynecologists and doctors, and always been told, like, you're fine, that sounds fine, like, take more Advil for the cramps. And that attitude didn't really change when I started working with reproductive endocrinologists.
Yeah, so my wife has had endometriosis for quite a long time, a lot longer than before she was diagnosed.
Numerous of times I was told that I had a low pain tolerance, and that's why I was having this issue.
I had my first GYN visit, and it was just told to me that, most African American women just deal with having heavy menstrual bleeding as well as symptoms.
I would bring up to them, I get cramps and then I vomit. I have fainted while trying to take a shower. If I was driving home from work, there were times that I had to pull over while on 95 to throw up because the cramps were so bad.
The doctor saying to me, take the pill, you'll feel better, it'll be okay, and it wasn't okay, and just that, it was almost, I can't even explain, it was like you were waiting to be murdered every month, and you knew you were going to be murdered, and someone was going to hurt you terribly, and there was nothing you can do to stop it. There was nothing you could do. You were going to feel pain, you were going to be sick, you were going to miss work maybe, you were going to miss deadlines and things like that, and it was beyond your control. There was nothing you could do about it.
During this time, I had saw my doctor 4 times. During this time, she had done 3 blood tests. Everything came back fine, except my liver enzymes. They were escalated as if I was an alcoholic, and then that's when they began to question me. Do you drink and things like that? And no one would believe me.
In the hospital, I was asked a lot of times if I was a recreational drug user. They would point out my body weight and that I was skinny. And they assumed it was because of drugs. And it wasn't. It's because I couldn't eat. It's because I was too sick.
She kept thinking that I had some STD that they couldn't figure out. She would always question me my sex life. Are you sure that you don't have more than one partner? Are you sure that your partner isn't having intercourse with other people? Are you using the protection you should be using? Because it sounds like it could be an STD.
I went to a specialist who told me I should go see someone else because it was all in my head.
I had seen 14 gynecologists and had 7 MRIs and 2 CAT scans, en route to just never giving up, that I deserved more than whatever was going on with me, and I didn't really know what was going on with me.
They gave me an STD screening, a pregnancy test, a sonogram, transvaginal sonogram, a CAT scan, and doped me up and sent me home. The only thing that they found was a teeny tiny little cyst on my left ovary and said, well, there is the problem. We have solved everything. Off you go into the world.
And when I did my own Google research, I found endometriosis. And I asked my doctor about it, and he said that I was too young to have endometriosis, and it doesn't affect people the way that I think it does. It only affects fertility. And that was when I was 16. So I waited about 10 more years before I finally found a doctor who said, no, that's not a normal pain.
22 years of symptoms before a doctor said, you have endometriosis. There are no words.
If it were men who came in to a doctor with pain in their groin, they wouldn't say, oh, the testicle pain isn't real, just go home and deal with it.
So I decided to go to an endometriosis specialist in New York City. He was like, oh boy. And I was like, I'm in the medical field, no filter. Please tell me, what do you see? And he was like, I'm going to be honest with you. You're all messed up inside and you need surgery yesterday.
It turned out that the endometriosis was extensive, and I was diagnosed with stage 4, but I think it was well beyond a stage 4 at that point.
He found deep infiltrating endometriosis, and I was pretty much unable to walk or to sit up. I couldn't keep any food down, and it was worse than he had expected it to be.
The surgeon said that it took her almost like an hour and a half just to reestablish my anatomy, which basically meant that she looked in there and couldn't find the organs in the places that they were supposed to be, and had to cut tissue and growths away just to be able to identify all the organs and guide them back to the places that they needed to be. And that was because the endometriosis had pulled them in different directions, adhered them to different parts of my cavity, nothing. Ovaries were stuck to my intestines, like nothing was where it was supposed to be. My uterus was inverted. It was a total disaster.
And what's normally a simple outpatient procedure, I was hospitalized for 2 days after surgery.
My surgeon said that she actually couldn't even find my right ovary. There were so many masses of tissue and nothing was in the right place. So she believes that it was inside of a mass that she took out of my body.
He removed my left fallopian tube. It had become diseased.
This is after multiple, ultrasounds for years where people were like, it looks kind of weird, but I think it's fine.
There was a lot in the rectal lining. He had never actually seen endometriosis that was so deep. In the pathology report, he actually wrote that he's really interested to see how I would recover from this because they've never had to go so deep.
I had 3 surgeons. There was a urologist who just helped preserve aspects of my kidney so that they wouldn't be damaged during the surgery, a colorectal surgeon, and then the endometriosis specialist. And the 3 of them worked together throughout the 6.5-hour surgery to remove as much endometriosis as they could find. And it basically, went all the way from my diaphragm, which they identified endometriosis on my diaphragm, all the way down through my bladder, my kidneys, every organ that's in there was implicated in the post-surgical report. Infertility to me is a disease, and I feel very passionate about having that recognized, that people who are trying to conceive and cannot are living with a disease, and that infertility is a symptom of something that is physically wrong with us. My husband and I started trying to conceive when I was 28, so I went off birth control, and we quickly learned that we were infertile. People would be like, oh, this ovary looks kind of weird, this tube looks kind of weird, but your periods are regular, and I think everything is fine. Like, everything's fine, you're young, let's do IVF. We had an unexplained diagnosis for the 3 years that I was working with reproductive endocrinologists. Anyone out there with unexplained infertility, the pain. It's just a horrible, horrible feeling. You don't know why this is happening to you. You don't know what's happening inside of your body. You feel like something is really wrong, and no one can tell you what it is. And for me, it turned out that it was endometriosis, and no one was diagnosing it, even doctors at the top clinics in New York City. The only time anyone mentioned endometriosis was after my first IVF cycle, when I grew an endometrioma that was the size of a grapefruit. And they said, oh, that's an endometrioma. But they didn't say, that's an endometrioma, and you have endometriosis, and this could be a really huge problem. My husband and I both decided, this is not the path for us. More IVF, more IVF. Looking back, I'm incredibly thankful that I didn't, because it was just, in the end, introducing more trauma to my body that desperately needed, surgical attention.
One night in July at that point, so we're really only talking 1.5 years after my diagnosis, I hit a shot as hard as I could down the line on the tennis court or the night before a tournament, and I felt something rip. I started to have pain all along my side and underneath my ribs to the point where I couldn't get a deep breath in. And I just kept taking Advil after Advil. And I lined up all these specialists to be in an operating room all at the same time. And the specialist that was working with me in terms of endometriosis gave me the leeway to pick what I wanted under what he was doing. So I had side pain, so I had a lung specialist in the room. I had a general surgeon because I needed the small bowel run. I had a colorectal surgeon because I had horrible bowel pain. I woke up and I remember my father saying, like, "You're okay, there was just a little necrosis." And I started screaming that if there's necrosis, you lose the ovary. And I started screaming and screaming and screaming until they gave me something to knock me out. The next morning, the doctor came in the room and he said, "I'm very sorry. When we got in there, you had complete adnexal torsion and you had occluded the artery to your ovary at some point and your ovary died." I didn't have that peace and that moment of entering into that decision that this is what I'm signing on for. Every day I just tried to recover. And then I decided that I did have one ovary left and I would try to pursue protecting it. And I got talked into, like, "Hey, your numbers are good right now. If you want to do an egg freezing, it has to be right this second." I was very ill. I did all my injections myself. I did everything by myself. And I would go in and I would ask the doctor, "Well, what if this? What if this?" And he would say, "All you're doing now is the freezing." And I'd want to, like, "What's it going to do to my endometriosis?" "All you're doing now is the freezing. That's only what's important now." We bring me in at 6 o'clock in the morning to do the harvest, and it's like kind of an OR, and they're putting me down, and I said, like, to the anesthesiologist, "Please take care of me. Last time someone put me out," which was only a year before this, "last time someone put me out, I woke up without an ovary." "That never happens. You're making that." "No, that's exactly what happens." I went out, and I thought I was doing the right thing. And when I woke up, the doctor I, of course, was still with my legs in the stirrups and naked. The doctor was an inch from my face, screaming, "We couldn't get any eggs, and there's nothing left in your ovary. You're infertile." Any idea in life that you've ever had of what it's going to be like when you grow up includes being a wife and being a mother. And all at once, without ever knowing it was going to happen, that was gone.
I met my husband, Evan, back in 2001. We got married in 2006, and we started trying to conceive after a deployment in 2008. So we tried for a year, then we went to see an OBGYN who prescribed Clomid to me, and we did that for 4 cycles. I got pregnant on my 4th cycle, but unfortunately we miscarried at just about 12 weeks. We were in a unique situation with my first one too. We were literally packing our house to move from Georgia to Arizona the first time. I guess I processed that one differently because, a cross-country move is a big thing, and you kind of have to focus on that and not so much the loss. And I think I didn't really grieve that loss of that pregnancy until we had settled in to our house in Arizona. It's like the worst feeling in the world. I felt like I let down that baby. It's just something I would never wish on my worst enemy, a miscarriage. It's devastating on every level. It happens more than people know. and it's very isolating. Even if you move on and you have children, it's just something you never forget. It's always painful. You're always going to remember that anniversary, and the pain's never fully going to go away. I mean, you appreciate the children you have, but you think about the children that you lost. After that, we moved. I went to a new specialist, and I was officially diagnosed with PCOS. Was put on metformin and put on Clomid again. I got pregnant for the second time right when we had moved to North Carolina. I just feel like everything has coincided with a big Army thing. My second miscarriage, my husband was away for training in Louisiana while I was sitting in North Carolina bleeding out in my bathroom, and then had to go sit in the emergency room for 13 hours with a resident who just was not compassionate at all and tried to tell me I wasn't pregnant in the first place until he got the results back from the blood draw that he took. He'd be like, yeah, I really was pregnant. Why would I lie about this? And just constant going back to the ER because I hadn't established myself with a primary care doctor at that point, and going back for beta draws for I think it was 2 weeks until my levels dropped back to 0. And we went to see another reproductive endocrinologist when we were in North Carolina. Just have to give the history and relive all that pain all over again. Yeah, with my husband being in the military, it kind of made treatments interesting. He deployed when we were doing IUIs in North Carolina. We actually went ahead and made the decision to freeze some sperm, and I went through 4 cycles of treatment without him at home, which I think was more difficult because I didn't have that support from him in the house. I mean, I had friends locally who helped and through the Twitter community. I mean, everybody was great, but just having him not there and me having to do it by myself, I think was really difficult. And we started going through the gauntlet of treatments. We did Clomid again, we did Femara, we did IUIs, we did 2 IVF cycles and 3 FET cycles, and they were all unsuccessful except with 1 chemical pregnancy with our second IVF cycle. But I mean, a chemical pregnancy to me is still a miscarriage, and I feel like don't let people tell you that it's not if you've gone through this. The 3rd miscarriage was, I refused to believe that it was even a positive test because I couldn't imagine going through another loss all over again. And as soon as it began, it was over. My husband wasn't there again with me. He was in Arizona for training, and I kind of had to deal with that loss on my own all over again. So we had started with our diagnosis of PCOS, and unfortunately when our last FET cycle failed in September 2013, I was given the diagnosis of unexplained infertility, which I feel was a hard pill to swallow because we had tried everything and took all the medicines for the previous diagnosis and none of it worked. Nobody except my current OBGYN here has even brought up endometriosis as a possibility, which kind of is frustrating because I feel like we could have explored that option before we went down the IVF route. We are in the middle of adopting our daughter who just turned 1 back in February, and that whole process has been a nightmare legally, and I just wasn't ready to deal with something else right now.
Infertility, what it means to me is that there's no babies, there's no legacy. There's no one that I leave behind.
Infertility means fear, it means possible devastation, it means taking a chance. It's too many what ifs for me. You know, I like a sure thing in my life, and it's a scary world that I have a hard time dealing with.
Luckily, my sister has had 3 babies, and I do have them as my legacy, but of course, it's not my own. I think a lot of endo patients get a lot of joy out of mothering other people's children, but you go home knowing that they're not your babies.
I think infertility to me means sadness because I see so many women who can't have children, and I know it's like such a loss. Like, you can't, I feel like I can't sit here and really describe it because it's something so deep inside of you when you can't have a child.
Infertility is tragic to me.
I don't know, I've kind of accepted that I have this disease called endometriosis. And so infertility means to me like acceptance of what you cannot have.
Depression and anxiety play a big part in my relationship with endometriosis. I don't believe my depression is a chemical imbalance. I believe it's a situational depression. When your body is broken and your bank account is empty and you've lost your job or whatever it can be, you become depressed because of the situation.
And I felt so hopeless, and I felt like I was being punished for something that, maybe being promiscuous or anything. Just I was being punished for something, and I couldn't really put my finger on how bad of a person I was to have to go through such an awful, awful thing, and there was nobody that could help me.
Made me ashamed of my body. It's made me hate what I see. And it may be invisible to everyone else, but when it's something you feel, it makes you feel ugly.
You really lose sight that there's more to you than just this debilitating disease.
I realized what this road was really going to be like, and it was tremendously defeating to my yay, I'm empowered type personality. And I cried for months because I felt like I had such good quality surgery, the first surgery, to have a complication and to really realize I'm on that surgery train forever was defeating. But defeating, not like, oh, I feel defeated. Defeating to my soul.
And you feel alone. Despite that there are so many people out there, you feel very alone in your pain because you know it's not going away. You know there's no cure. You know that this is your life.
So having anxiety and having endo is like walking through a minefield with a grenade in your hand. Everything is going to go off and explode, and it's going to be messy. I had some pretty bad social anxiety all throughout, probably as long as I can remember, come to think of it. Just an anxious kid, and as I got older it got worse because once you get older you have more demands. I'm actually on Xanax as needed just because my anxiety is so bad and it causes my endo to flare up to where I can't leave my house.
After my surgery, before my surgery, obviously there's a lot of anxiety and that's kind of normal. After my surgery though, I definitely plummeted and the anxiety was intense, and the depression was intense as well, and there were definitely feelings of I'm never gonna get through this, I'm never gonna be healthy again, I'm never gonna be able to do the things I need to do. This disease will never leave me, I will have to have this surgery again, like just really hopeless, terrified feelings. It was a really difficult time.
With anxiety, it's a fear that at any moment something can go wrong. I know for me, I'm afraid to say today's gonna be an okay day. I'm afraid to let my guard down.
Some days it requires a lot of attention to help my wife get out of bed, or say to massage if she's got a certain area that's in pain that day, or to help her eat certain foods or take certain medicines. And then other days you're perfectly fine.
After surgery, I let my guard down, and 2 months later I was back in the hospital.
And I developed horrible anxiety. Horrible anxiety. Because it's like I didn't know what was going to be from the world.
You can't let your guard down. You can't be comfortable in your life.
And if you have a good day, you're worried about it in advance of if you're going to have a good day. And then even if you're having a good time, it's like, well, when's it going to end? When is the shoe going to drop the next time in terms of not feeling well?
Now here's this disease cohabitating inside my body, so that makes my anxiety so much worse. So going to the doctor is a thing. What are they going to tell me? Are they going to send me away? What's going to happen? Why won't anybody talk to me? Do you know what you're talking about? I know what I'm talking about. Are we on the same page?
I will, have anxiety for days before a doctor's appointment. I will cry in every doctor's appointment, dentist appointment, anything in a medical setting where, I'm hoping to be able to trust someone and asking them to help me. That is a vulnerable place that, I've been hurt in that place so many times that it's really, really, devastating for me to be in that place. It's a huge, huge challenge for me now.
Coming to terms with the fact that I'm sick and I may or may not be able to have kids is still something that I struggle with.
I really had to, take stock of what I believed in and how I felt about the disease. It's just it's so life encompassing.
This condition was way more serious than I really took it to be, and I had to really get my life together.
Because you realize how much of your life needs to change, which is fine, and you take in a lot of that change under an empowerment type feeling, but much of it is devastating.
I was lucky enough to find someone that could help me. In that help, it was about putting me back together, and realizing it really does suck. This world is built for women that have children, and that's what life is for so many people, and that's not what life is going to be for me, and so I have to forge ahead no matter what.
At this point in my adulthood, I know that I need to utilize therapy. I know I need to talk about it with a peer group who understands, and I know that medication helps. And for sure, after my surgery, I went back on antidepressants and have anti-anxiety medication to help me deal with these feelings and be able to function and continue to improve myself.
And, I try to approach it like any day that my wife has endo could be the worst day of her life, and so I give her maybe a bit of a pass, or I try to be as patient as I can if it's something that's small or that really shouldn't become a big issue, because if you're not walking in someone else's shoes, it's kind of hard to criticize someone.
The thing that gives me hope is, I would say, my one friend who's going through this. I texted her right away.
When I talk to other women, they're like, oh, my legs hurt too, and I'm like, that's the strange part of it. It's the community has given me such solace. Like, before I had a community, I was in such a terrible mental state.
And now that I'm an advocate and now that I'm a blogger, I'm meeting so many more people that are not afraid to say something. The emails that I get from people like, wow, I was so scared to say something, but thank you for being my voice. It kind of makes me feel like Superwoman.
I've recently started reaching out to different women who have found me through friends of friends, and they've talked to me about what they're going through, and I try to help them, and I realize that while I may have, what I feel like is a curse with endometriosis, I have the opportunity to help others, and that makes me feel great. That gives me hope.
And the other thing that gives me hope is my future. I absolutely love what I do. I'm a drug and alcohol counselor.
I got on a plane after the day I had the medical testing to go to China, to leave the country for the first time ever in my life, Because I was invited by the Chinese government to teach pelvic physical therapy and endometriosis to their doctors there. And I had these wonderful adventures. It didn't just save my life, it saved me. It taught me that I really wasn't my pain, and that I had such a gift to give.
At night, I am a circus performer. I train in Tarrytown for Westchester Circus Arts. I'll have such a horrible day and I'll feel so sick and weak and exhausted. The endo community is quite large, but the circus endo community is quite small. So, just overcoming all of that makes me feel really amazing.
I, wanted to put my story out there. I knew that there were other women who had similar stories, and I started a Tumblr called You Need a New Doctor, and it's a place to collect stories from women with infertility and related diseases about the misunderstandings and misdiagnosis that they receive from doctors. The stories are heartbreaking. They're presented, with a sense of humor as we all look back and try to process these things and, share our stories with other people.
So I am the 2015 Passion Award winner by the Women's Health Foundation, which is an award given annually to a woman who has survived arduous battles with pelvic pain and gone on to become a beacon of light to their community. In my case, the endometriosis community, and this is a fantastic honor.
I've been able to help people figure out, grief for miscarriage, or are starting their first IVF cycle, or are getting ready to pursue adoption. It feels good to be able to help people and not make them feel so alone like I did at the beginning before I was able to find support through, Twitter and just other people. And we met great people at Advocacy Day. I think it's just important to share your story, but when you're ready, because there's so many people that can benefit from your experiences.
I have endometriosis, but it does not have me. It does not define me.